We're ready to go right into the presentation. Mental health services updates. City Manager Brian Wilson. Human Services Manager Colleen. Go ahead. I'm sorry.
Great. No, thank you, Mayor and Council. So it's my pleasure to introduce two speakers tonight. First is going to be Colleen Bryant Schluter, our Human Services Manager, and then also Kelli Nomura from King County Department of Community and Human Services. So as you can see from the agenda bill tonight, this is a follow-up to a council request to understand the mental health services and system that's present in King County and how that system integrates with the city of Burien and certainly with the services that we provide and our public safety services through the Burien Police Department. We, as you know, have adopted a leading with services model, and with that, looking at police type response and what are the opportunities where a lot of the police calls have to do with people that are experiencing mental health crisis, and what is the best way to respond. And what I can say is King County's been working very hard to enhance their comprehensive system, to have a recovery focused, system. And then also, how does that integrate with the services that we're providing? So as you know, our leading with services has a combined effort with LEAD, co-lead, our DESC supportive housing, our storefront officer, our business outreach social worker, which is part of our planning that has been approved by council, our community response team and co-response model, Burien Police Crime Reduction Unit, and certainly all the coordination and alignment of human services, behavioral services, and how does that integrate with the county system. So with that introduction, I'll hand it over to Colleen and go ahead.
Thanks so much, City Manager Wilson. Good evening, Mayor, Council, and community. Mental health is an incredibly broad topic, and so we're focused primarily on the crisis response system this evening and what King County is doing and how it integrates with the work that City Manager Wilson just mentioned. We know that both physical and mental wellness are crucial to good health. We know that this topic is complex. And we know that mental health issues affect people in every country across the world and are closely linked to poverty, discrimination, and overall health and well-being. Certainly, COVID-19 has only exacerbated mental wellness needs across our nation, with more than 40% of adults reporting symptoms of depression and anxiety. And our most vulnerable, our children, our folks experiencing homelessness, are feeling mental health effects most intensely. We know that our kids are facing many challenges, including their mental health. As with most industries, the pandemic has forced operational changes and shown us that really systemic transformation is possible. Transforming mental health means a willingness to rethink or retool investments and approaches. And I'm excited to be working with Kelli and other folks at the Department of Community and Human Services. Kelli is the Director of the Behavioral Health and Recovery Division in King County's DCHS. And she's here to share with us about the efforts King County is making to create, as City Manager Wilson alluded to, a more comprehensive system that really anticipates needs and looks at recovery-focused interventions throughout that crisis continuum of care. So Kelli, thanks so much for your patience and waiting to present and for being here this evening.
Absolutely. Thank you so much for inviting me. Mayor Mata, Deputy Mayor Marks, and council members, thank you for having me tonight. I appreciate both Brian and Colleen's words tonight and the recognition of the impact of COVID on all of us and the importance of behavioral health services to support all of us going forward. So I am here to talk briefly about our behavioral health system, and in particular, I was asked to focus on our crisis system, which I'll do tonight, and then address any questions you might have, and see if there's any need for me to return in the future and have continued conversations, I'd be happy to do that. So again, Kelli Nomura, Director of the Behavioral Health and Recovery Division, King County. Next slide. I just briefly want to give you a little bit of information on the Behavioral Health and Recovery Division to kind of set the stage here. We are one division within the Department of Community and Human Services at King County. The other 4 divisions that make up our department are developmental disabilities, housing, homelessness, and community development, adult services, and then children, youth, and young adults. So as you can see, all 5 of our divisions work very closely together, providing through the Community and Human Services Department resources, supports, and funding for services across all of King County. Next slide. So what does the Behavioral Health and Recovery Division do? Well, our primary objective is to manage the administration of behavioral health services and programs for low-income King County residents. And when we talk about behavioral health, we're talking about both mental health services and chemical dependency treatment services or substance use disorder services. So collectively, they're known as behavioral health services. And we manage those services by contracting with a large number of provider agencies in the community. And those agencies provide those services to individuals across King County. On a limited basis, the Behavioral Health and Recovery Division does provide direct services. An example of that being one of the teams that does report to me is our designated crisis responder team. Those are individuals that go in the field 24/7 and do assessments for involuntary commitment across King County. So we do have on my team about 5 teams that provide direct services, but for the most part, all of those services are contracted out to provider agencies. And finally, an important component that we do is we perform delegated administrative functions on behalf of the 5 Medicaid managed care plans here in King County as of January of 2019. Next slide. I was asked to talk specifically about crisis services today, so that's what I'll focus on, our crisis system across King County. What we do and what we believe is that a high-achieving, a high-quality crisis system really relies on a comprehensive system design that anticipates needs and provides recovery-focused intervention across these 5 phases. All of these are important and necessary if we're going to have a strong crisis continuum. Phase 1 being prevention. Phase 2, early intervention. 3 is acute intervention. 4 is the actual crisis service component. And 5 is recovery and reintegration. We really do focus on all 5 of these phases so that we offer and have a strong continuum of crisis response. In addition to these phases, we really believe in 5 key drivers. And first and foremost, and especially dear to my heart, is working with those and incorporating those with lived experience in our behavioral health system response. Their experience, their skills, their background really is important to incorporate in not only program development, but also oversight and service delivery. We have so many individuals in our community that have lived experience and have those contributions to bring, and we have to remember that every day as we're looking at developing and implementing services and care. The other thing that we rely on is strong collaborations with our partners and our stakeholders. Without that, we would be operating in a silo, and we definitely want to know and be partners with all of our community members, our stakeholders, and others. And also, we need to have strong logistics. We need processes to facilitate the movement of people. And in a data-driven system, we need to make sure that we have the data to make sound decisions that are going to impact and inform our outcomes and where we put our funding so that we can make the most impact. And we need competencies in the staff that we work with so that they have the skills to promote resolution and reduce harm. And then finally, we need working parts so that the services that are used are intended and producing results that we're looking for. So collectively, we always go back to these phases and these 5 drivers to make sure that our crisis system is effectively and efficiently delivering we have as a vision of a high quality crisis system. Next slide, please. In addition to those, we also want to come back to our system of care, make sure that we have at a minimum these 8 core components that are coordinated across our system. First and foremost is what we call our front door, or access to care. Access to our services is critical. If we don't have access, if it's not something that someone can access easily and across our county in a equitable manner, then we're not serving the community members and their needs. We want to make sure that we have mobile crisis units for response across all of King County. We know so well that we are no longer in a system where we expect all individuals to come into the brick and mortar system and get the services that they need. We have to be a mobile and community-based response. We need to have integrated substance use disorder and opioid solutions, again, out in the community, responding to where the need is. Crisis stabilization centers where individuals can go and get the resources and care that they need. We need providers that can serve all levels of care so that we have, again, response to every level of need. And then, of course, the designated crisis responders who I mentioned that do the involuntary treatment for those highest in need for an assessment of whether they need and would benefit from an inpatient stay. So across all of those, we want to make sure we have a system oversight and then close collaboration, as I mentioned earlier. Next slide. So what is King County's role in getting us here? Continuing to make sure that we are making advances, improving where we can, and working off of the lessons we've learned in developing our crisis system thus far. What we do bring as a county is a system-wide vision. Again, we are operating over all of King County, so we have the benefit of having a large system vision. We have local leadership that holds ourselves accountable so that we can make sound decisions and that we are, as I said, making changes as we need to continually improve our system. We're spending a lot of time right now looking at how do we ensure integration of behavioral health and physical health care, along with incorporating the social determinants of health. We know that the individual benefits, if we look at providing whole person care and moving away from separating, treating the physical health, medical health, and behavioral health. We have to integrate those and provide that whole person care. King County brings a lot of local investments to the table. At this point, it's about $30 million that we're using, and I'll speak a little bit more in a moment about utilizing those funds that we have access to really fill some service gaps that perhaps other funding sources cannot pay for. And then as a county, we have been providing these services and overseeing them for many, many years. So we bring longevity and experience in building and evolving in our response to the changing community needs. Next slide. So I'm going to quickly go through this. This is a little slide that tells you a little more about our funding structure. And this is for the whole system. It's not just specifically to the crisis system. But if you start in the far left corner there, the Healthcare Authority, and we follow the purple Medicaid arrows to start, you'll see that Medicaid flows from the Healthcare Authority at the state to the 5 managed care organizations here in King County, and they're listed there in the second blue box. Those 5 managed care organizations have chosen to contract directly with King County and flow those Medicaid dollars to us to manage and have oversight of the King County Integrated Care Network. This is our network of over 40 Medicaid licensed providers who provide some of the services examples in the box there. Again, the Medicaid dollars flow from the Healthcare Authority to the MCOs and back to King County to oversee the Medicaid system of care. And King County is the only county where that structure is in place. All other counties and regions in the state, the funds go from the Healthcare Authority to the managed care organizations directly to the provider network. If you follow the green non-Medicaid arrow from the Healthcare Authority, the Healthcare Authority contracts with each region in the state of Washington that is known as the BHASO, or the Behavioral Health Administrative Service Organization, to fund the crisis system dollars, the non-Medicaid dollars that are available to stand up the region's crisis system. And for King County, the BHASO is the Department of the Behavioral Health and Recovery Division. So we hold that contract with the Healthcare Authority, and those non-Medicaid dollars flow into us. And again, we turn around and fund the crisis system. Some of those crisis services are listed in that box there that I've mentioned: designated crisis responders, prevention services, our children's crisis outreach response team. Those are just examples of some of the services funded by those non-Medicaid dollars. And then finally, at the bottom, our locally funded services. Those are funded through our MID program, which is the Mental Illness, Drug, and Dependency, 1/10 of 1% sales tax that we get and have received for many years. Those are the dollars that we are fortunate to receive and be able to, again, address some service gaps that we may have that Medicaid or non-Medicaid may not fund. And we are fortunate to use those dollars to stand up a variety of programs, including supported employment for those with mental illness and different education and workforce development services. So that's just kind of an overview of how the Medicaid, the non-Medicaid, and our 1/10 of 1% sales tax come together and blend to create our overall system. Next slide. Another way to look at this from the crisis system perspective is, again, the Healthcare Authority contracts with us as the BHASO, sending us the non-Medicaid dollars there in the black box. We also get the mid funds in the purple box, and the Medicaid funds, the 5 managed care organizations in the red box. And collectively, King County's Behavioral Health and Recovery Division blend all of those funds to create our continuum of crisis response. And those flow down to the individual client or the family or the couple or whoever is receiving those services. Next slide. So some of the benefits of having the BHASO crisis system contract with the Healthcare Authority here in King County is, as I mentioned, our model allows us to have multiple payers paying into our crisis system and blending those funds, so that we can serve anyone in King County who goes into a behavioral health crisis. Another benefit is that those crisis providers that do all of the work only have to contract with one single payer entity, and that's the Behavioral Health Division. Instead of contracting with all 5 managed care organizations and the Healthcare Authority and having to then receive payment from each of them and turn around and report out data and report 6 different ways, they contract with us, and we do all of the behind the scenes data submission and contracting work. So it's more efficient and effective for the crisis providers from an administrative simplification standpoint. Our current model also uses federal funds to support our crisis hotline and mobile crisis outreach, those federal funds being block grant dollars that are part of the ASO funding. So we are able to bring those dollars to the table. And we are able to, through our oversight, a single entity oversight, have a seamless connection between our crisis line and our crisis response system that is coordinated, again, under us as one entity, minimizing minimizing, again, contracting and maximizing communication. Next slide. So this is a visual of our crisis continuum. I'm going to go into detail in a couple of these examples, but I think what is important here is for you to see that on the far left is our least restrictive crisis options. All the way to the far right are more restrictive crisis options. So you'll see on the far left, the 24/7 crisis line that anyone in King County or anywhere across the state can call and get support and crisis intervention, all the way to the far right, which is, again, our DCR, evaluation for involuntary commitment. One of the things I will say is that you'll notice the dark green crisis services. Those are all required with any BHASO contract in any region of the state. So the 24-hour crisis line, mobile crisis outreach, and then voluntary and involuntary hospital treatment. But the more lime-colored green services in our continuum are all funded from our local funded resources. So those are services and programs that King County has chosen to stand up with local dollars to be able to supplement and strengthen our crisis continuum. And we are adding more and more of those programs every day as we see the need for continued crisis services, but also more options that are less restrictive than inpatient hospitalization. So I'm going to go through a couple of these just to give you an idea what some of these programs are. Next slide. Our crisis line, also known as Crisis Connections, is a 24/7 crisis phone line for anyone to call. And you'll see that they average about 90,000 calls a year, and around 50,000 of those were resolved with no further intervention. So the Crisis Connection was able to take those crisis calls, assess the situation, and handle and manage the situation on the phone and get that crisis resolved. For the cases where they needed additional support, here's some examples of where they referred those individuals for additional support. Referrals went to outpatient behavioral health providers, emergency next day appointments, mobile crisis response, referrals to local emergency rooms and first responders if needed. Those are always our last resort. And again, our designated crisis responders. But we have a very strong crisis line that's been in place since 1964, providing phone crisis response to anyone in the community. And it's a really good way for individuals to reach out and get their crisis at least initially assessed and triaged. Next slide. Here in King County, we also offer over 200 adult next day appointments each month. These are at various behavioral health provider agencies across King County. Those agencies offer a next day appointment to anyone who is in crisis, and these are scheduled through the Crisis Connection phone line. There, that individual can get crisis intervention and follow-up stabilization services and up to 5 follow-up visits by staff in the agencies trained in crisis response and crisis management. Often through those 5 visits, they are referred to long-term behavioral health or other care as follow-up. And many of those referrals come from emergency rooms, our own DCRs, who assess the situation and determine maybe they don't need to be involuntarily detained, but a next day appointment would be useful. Our primary care clinics utilize the NDA system, as well as inpatient hospitals and ERs. And this is really a valuable resource. We do both mental health and substance use next day appointments because sometimes that individual does not need to be in the hospital, nor do they need to be sitting in an emergency room. But knowing you're going to get to see someone the next day to help listen to you, problem solve, and identify resources can be what that individual needs to be able to say, yes, I can walk out of this emergency room and feel safe and know that I have a follow-up appointment. Next slide. Our mobile crisis response teams are contracted through the Downtown Emergency Services Center for our adult outreaches and the YMCA for our youth outreaches. These have been in place well over 10 years now, and we see the value of this model and continually look to expanding these resources in other parts of our community. These operate 24/7, and they provide outreach to any location in King County. And as you can imagine, having only one team for the adults and one for the youth is not enough. So we are continuously looking at ways to fund more of these mobile crisis teams to respond to the whole of King County. The teams consist of 2 trained mental health clinicians who are able to respond on site in the community, assess the needs, and then put together a plan for how that individual is going to get resources and support. And often some of that plan is providing transportation to that next resource. Next slide.
I want to just, so when you say a couple, that means 4, 2 for adults and 2 for youth. Is that correct?
Well, we have the DESC program is for adults, and they operate out of the city of Seattle and then also now in the South End. And the Y has a response to our youth in the community that might be in crisis. Both of those teams are county-wide response, but as you can imagine, that is quite a volume to respond to. So we are looking to expand to more mobile crisis teams, either through DESC and the Y or other providers, because the value of this type of response has been known for a while. It's just, again, these are programs that have to be funded through alternate funding resources. So finding those resources can be challenging.
How many FTEs do they have working on crisis where people need that extra attention?
How many cases? How many
How many case
individuals?
managers? Yeah, case managers or full-time employees.
I would have to get back to you on that, but I know like the DESC mobile crisis team, there's probably 40 staff, 40 of them. But again, it's nowhere near enough to respond to the need right now.
Thank you.
Another program operated by DESC is the Crisis Diversion Facility. This is a 16-bed facility that provides crisis and stabilization services for individuals in a behavioral health crisis. It serves as an alternative to going to the jail or hospital emergency room. Admissions can happen anytime throughout the day or night. And the individuals are, again, this is where you get assessed. Planning happens on what kind of resources you can access, in particular after you've left that facility. But this is just, we have one of these and it's a 16-bed facility. So again, access depends on bed availability.
16
Next.
beds for the whole county, 16 beds for the whole county from DESC for somebody that has a crisis where it needs to be stabilized instead of the emergency room or a jail cell. You're saying you only have 16 rooms in the county.
This facility is a 16-bed facility, yes. You know, for someone who has that kind of a crisis, if they're enrolled in our behavioral health system, we have the behavioral health provider intervene and provide support for that crisis if possible. The challenge is when the individual needs a safe place to stay that is not a locked unit because they don't need an involuntary placement. We need many more of these facilities to be able to provide that overnight or extended stay. Next slide. And then again, this is our, you know, the farthest up our crisis continuum, where, you know, we want to only use this as the last resort if someone truly does need to be assessed for involuntary placement at a psychiatric hospital or an evaluation and treatment facility. Our designated crisis responders do those assessments and they assess for danger to self, danger to others, or grave disability. And that individual, out of the, I would say about 8,000 referrals that we get a year, you know, not all of them get placed in the involuntary hospital stay. In fact, most don't. But for those that do and do need it, we do place them there for a 5-day stay in hopes that they will be stabilized and again, connected to resources and treatment upon discharge. Next slide. So we keep a lot of things in mind as we're talking about and thinking about our crisis system and what we believe that we need to continue to have in place for a strong crisis continuum. One is building on the existing foundation. As I said, we've been providing crisis services here in King County for a long time, and we have many programs that work, and we need to continue building on the efficiency and effectiveness of those programs. And establishing a stable and sufficient funding model. As I've mentioned, it takes multiple funding sources to braid together to pay for these resources. Unfortunately, Medicaid does not pay for all of these, and so regions have to be able to find and braid other funding sources. Investing in our workforce. We all know that there's a workforce shortage now, much more following COVID, but even prior to that, the behavioral health workforce, we've always had challenges in recruiting and retaining our staff. And then, as I mentioned, expanding mobile crisis programs and other alternatives to not only emergency room utilization and high costs, but also as a alternative to our criminal legal response. We really don't want to see people in jail as a result of their needing behavioral health treatment. We should be treating them in behavioral health facilities and behavioral health opportunities. In addition to that, other things that we look to for our crisis system, as I mentioned before, is access to care and partnerships with our stakeholders, and then strong advocacy, both locally and also at the legislative and federal level, as we continue to communicate and share our need for strong, sufficient funding so we can continue to provide the services that our communities need. Next slide. So I talked a lot about the overall King County crisis system, and I know I didn't speak specifically to Burien, so I wanted to make sure we left time for questions or conversation about Burien specific behavioral health programs, services, and collaborations, if I can talk about those or answer any questions you have. I know that when I was asked a couple of days ago to do this presentation, we wanted to specifically focus on the crisis system. So, but I want to make sure and leave time for that or come back and talk about that at another time. Next slide, and it'll have my contact information. You're welcome to contact me. And as I said, it was mentioned, perhaps I come back sometime after January, which I'm happy to do. I also want to make sure and you're aware of and invite you to our 2021 Behavioral Health Legislative Forum, which will be December 7th this year. This is a forum that we've done every year for over a decade, where Executive Dow Constantine and I will speak to our behavioral health legislative priorities for 2022. We have legislators attend, and they have an opportunity to listen to their constituents and also answer questions. So please save the date if you're interested in attending, and we'll make sure that we get more information out to you. So I'll stop there and see if there are questions or if there's time. I don't know how long your meeting goes, so I don't want to keep you. But if there's questions I can answer, I'm happy to stay on and answer questions, or like I said, come back and join you again at another time and speak about. There's a lot of parts of our system that I'd be happy to speak more about, in particular our Medicaid system. I think that's a really important one for all cities to understand how we provide Medicaid services. But I'll stop and see what questions you might have. Thank you so much.
Go ahead. Thank you, Deputy Mayor Marks, and then we're going to go to Councilmember Erdogan.
Thank you, Mayor Mata. Kelly, thank you very much. And Colleen, thank you for setting this up as well. I think this is what I was hoping to hear about to start with, is what King County has in play, and then moving into a deeper discussion about what Burien is already taking advantage of or partnering with you on. So I think this was good. It gave me a very good overview of how restricted, not restricted, how limited funding is, where the emphasis has already been placed, that there is a continuum of care, which is good to know about when folks call in to or write into council and say what is being done about X, Y, and Z, what can be done. This allows us to talk a little bit more about, there's a whole less restrictive all the way to very restrictive, and there's policies in place for each of those different colored green blocks on the continuum there. I do look forward to hopefully having you back to talk specifically about the partnership that Burien has, what we are utilizing outside from lead, co-lead, and how our other programs might or already do align with what the county policies are.
Go ahead, Councilmember Erdogan.
Thank you, Mr. Mayor. This was a very interesting presentation. Thank you so much. And we are diving into a piece of it, which is the crisis response. And so I'd be interested in how many Burien residents use that system. And secondly, too, I think it's really important to think about, I would like to know how much effort we put around prevention, and what's the role of the city in that, and what are we doing, and what's our best role there? Because I'm interested in identifying mental health risk factors early and seeing what's the best role for the city to do that for our residents here.
Absolutely. I could at another time come back and your question about Burien specific members, community members, we can look at some data. The other thing is we do a lot of work on prevention for both adults and also significant amounts for youth. So we can take a look at that as well. Thank you.
Council, is there any other council member would like to ask questions or give a comment? First of all, I want to thank you for coming here today. There was some stuff that I'd like to hear. The involuntary commitment, right? I think that's. I think when I've said this before. It's not that I'm blind and I can't hear what's going on. I see some people that are suffering from severe mental health illness, but they're not violating the law. I mean, this is America, and so just having this conversation today, say, well, we should pick them up off the streets. Well, first of all. We could pick you up off the streets also, and if we want to start comparing, whose rights we're going to violate here, right? So I think one of the things here, to me, it's more about community education, business education, because I don't see much of that going on. I mean, generally it's left for us, and to be quite honest, today I keep on learning more and more about the obstacles that we have, because everybody says, load barrier shelters, or a lot of the buzzwords, right? There's whatever beautiful words that are used, but what the reality is, we have no beds in Washington State, and the reality is, if it's not in our backyard, whose backyards are going to be? And so I think that it's important that we in Burien here hear what the county's doing. And I heard, like what you said, you've been doing this work for quite a while, since 1960, 64, I think I wrote here. So to me, it's important not to reinvent the wheel. I think we have a county that's already been working at it. I can tell you personally, I'd like to continue to work with the county, because this is a pandemic we're going through, not only with the virus, but also with mental health illness on our streets, the unhoused people that are suffering every day. And I think it's important, first of all, that we know, okay, what does the law allow us to do, not only locally, county, state, and federal. And here recently, I was just meeting with Cascade. I think it was called Cascade Mental Health. And I got to tell you, I was shocked with the amount of beds that there is, and I got really educated by the challenges that we have, not only federally, but as a state, when we started defunding mental health in 1980. And then on top of that, we just continue to do that as we're at today. But to me, I don't think this should be the last. I think this should be one of many. And I want to thank you, City Manager, because I think this is very important. For the residents of Burien, for the business community in Burien. I'm not going to bounce around it, because I've been supportive of DESE in the city of Burien, because we need a place for people that are suffering mental health, in the county. Every city should have one. We shouldn't dump it all on Seattle. And so to me, it's a facility that we're going to have the specialists, people that go to school and get educated on this. And as far as recruiting, I'd like to also, when you come out back to Burien, is if you can tell me, or you can kind of tell us how y'all recruit. Where do you recruit? What communities you recruit in? Because that's one thing that I haven't really seen much of, is recruiting. I hear that we're having, like, Wash State Transportation is having problem recruiting. I know that the construction is having problem recruiting, but when I go to community events, I see building trades people, or I see or I see other people. But when I go to community events, I don't ever see people are trying to recruit workers that reflect the community. So I'd like to hear kind of what, because it's probably going on, I just don't know, right? And I don't know where to turn people. I know that here in Burien, we have a lot of youth graduating, coming back from graduation and not finding opportunity. I can tell you that I hear a lot of that from, young people of color specifically, right? Because in closing, when I was growing up as a farm worker, I only knew other farm workers. I didn't know anybody else. That was my little circle. And so I think if we can help expand that circle of communication, of opportunities, it's not only going to benefit the county, it's going to benefit the places we need to fill. Even with law enforcement, I was just talking to the training facility saying, hey, why don't we have a summer camp where we have our youth go out there and, experience, go through an experiment, figuring out, okay, do I really want to be a police officer, right? But I want to thank you again. This is near and dear to my heart. I see the suffering on the streets every day, and I hear some awful conversations coming from people that you have lost what humanity is all about. So I appreciate the work you do, because it's a special work. So thank you so much. Council, is there any to give a comment, ask any more questions? If not, I want to thank you. Have a wonderful afternoon.
Thank you all. Look forward to being back.